Welcome to The Pulse, the official podcast of the Georgia State Medical Association.
Hello. Welcome and welcome back. Thank you for joining us. I am your host, Dr. Kimberly Williams, the Executive Director of the Georgia State Medical Association. Today, we are focusing on a topic that is vital for our families, our children, our patients, and our communities: vaccines. Vaccines save lives, protect us against serious diseases, and are one of the most effective public health tools we have. But many of us, like you, I'm sure I have questions. We have questions, concerns, and sometimes confusion about vaccines. But to help answer these questions and to offer some insight, I have the privilege of hosting not one, but two guests, both physicians here in Georgia, public health advocates, to help us separate fact from fiction, talk through the science in plain language, and offer insight to many of you trying to make decisions right now. So I'll introduce our guests, not in any particular order. I'll start with Dr. Winston Price. Welcome, Dr. Price.
Welcome.
Thank you. Dr. Price is a board-certified pediatrician and a past president of the National Medical Association. He earned his MD from Cornell Medical College and completed residency at the Weill Cornell Medical Center, Sloan Kettering Medical Center. Dr. Price serves as the president and chair of the National African American Drug Policy Coalition, Chief Technology and Information Officer for the W. Cobb NMA Health Institute, and member of the Medical Society Consortium on Climate and Health Steering Committee. He is also, all of these accolades here. He's a professor, associate professor of pediatrics at the Philadelphia College of Osteopathic Medicine and clinical assistant professor at the Medical College of Georgia. Dr. Price received the Presidential Commendation Award in 2020 from our prestigious organization, the Georgia State Medical Association. In 2021, he received the Practitioner of the Year Award from the National Medical Association. And in 2022 and 2023, the Distinguished Service Medallion Award from none other than the Georgia State Medical Association. Dr. Price also practices clinical medicine, serving the Southwest population in Georgia, focusing on clinical care. So thank you so much for joining us. Excuse me.
My pleasure.
Thank you for joining, Dr. Price. And then I'll introduce our second guest, the illustrious Dr. Ericka Russell-Petty, who attended the Pennsylvania State University for her bachelor's degree and then received her doctorate degree from Penn State's Medical School in Hershey, Pennsylvania. After her residency, Dr. Russell-Petty joined the South Atlantic Medical Association, or SAMA. That's the local society to the Georgia State Medical Association. Dr. Petty was elected and served as secretary for SAMA for 3 years and then president of SAMA through 2015. She led SAMA to partner with Savannah-Chatham County Public School System and to start a mentoring program in which high school students who were interested in medical careers were able to join and shadow SAMA physicians. As president, and yes, Dr. Russell-Petty was a past president of the Georgia State Medical Association, she spoke in a press conference with the Savannah Mayor Van Johnson, who became the first city in the state to implement mandatory face masks to combat COVID during the pandemic in 2020. Dr. Petty has participated in a number of press conferences, town hall meetings, church webinars, and news articles to clarify information about COVID and multi-system inflammatory syndrome in children. And the special honor that we can say about Dr. Petty is when Vice President Kamala Harris came to Savannah to visit during Senators Warnock and Ossoff's rally in 2021, Dr. Petty was able to introduce her. So with no further ado, I would like to welcome Dr. Petty and Dr. Price. Thank you so much for being here.
Thank
So
you.
let's get started. I want to kick us off and allow you to share with us information about vaccines, because we know our audience has a number of questions right now about vaccines. So whichever one of you would like to begin, please tell us, what are some of the most common misconceptions you hear from families about vaccines?
For me, I think that the main thing is families don't understand how vaccines work and how they help to prevent infection. Sometimes they think, oh, that's going to make me get that particular infection. So really just kind of what I like to do is to share the basics with families of how vaccines, where there is usually an antigen or something that resembles that particular infection, that is what the vaccine is that we're injecting. And what it does is kind of tries to fool your body to make your body think that you have that infection, so that your body mounts an immune system to it. Because when patients have to get the second dose or the third dose of the same vaccine, they're like, I thought I already got that. I'm like, yes, you have gotten it. But what we want to do is establish an immune system. So we want your body to see it and to see that same thing again, so that when it actually sees that particular infection, it'll recognize it and be able to hopefully keep you from getting that particular infection. So I think that's one of the main things, is just helping families to understand what vaccines do and that we're not actually making them get the infection.
Wow.
Yeah, I would agree. One of the major issues with vaccines is making sure that most people understand the difference between the pre-vaccine era and the post-vaccine era. And you certainly, in the introduction, elucidated the fact that this was a major public health strategy. And we've gone from hundreds of thousands of children and young adults getting disease, some with life-threatening consequences, and others with long-term disability related to the infection. And so we now, for most of the diseases that we have effective vaccines for, we still have a handful of pockets of infection that occur throughout the United States. But for the most part, we've continued to be on a trajectory of eliminating. For instance, polio, we've essentially eliminated in the United States. And diphtheria, we have maybe 1 or 2 cases in the United States. But every time individuals do not vaccinate, particularly when it's in an enclosed community, we have an outbreak of that particular disease. And there is certainly the possibility of us going backwards in time and having hundreds of thousands of cases of any one of the potentially morbid conditions. And we don't want to do that. There's no necessity of doing that. And then lastly, we kind of put our population in 3 different buckets. Those who understand the public health importance of vaccines and are fairly well accepting and just want some written information about the vaccine that is recommended. You then have another group who are what we call the vaccine hesitant group. They simply ask more questions than the average patient, but given the information, as Dr. Petty elucidated, and helping them understand how the vaccines are made and what they're for, they go ahead and have their children vaccinated. And then that last group is the one that we have the most difficulty with. They are the vaccine deniers. They don't believe the science. They listen to misinformation and disinformation, and they create a landswell of concern in communities that allow these diseases to resurface. So, this is important, particularly in the Black community. As we know, there are disparities. That is, there are differences in the uptake of vaccines in the Black community and in the Latin communities as compared to the white population. And we want to eliminate these disparities.
Wow, you mentioned disparities, and you mentioned specifically Black and Brown communities. Are there specific initiatives or things that you do to help? I know you described the 3 different buckets or groups of individuals and how you either ready to take the vaccine or somewhat hesitant or the deniers. But in the Black and Brown communities, what types of things do you talk to your patients about to encourage them to maybe move from that denying space into a more possible, we may get the vaccine?
Right. As Dr. Petty is well aware, we have different groups of individuals who listen to the wrong groups. They listen to the misinformation and disinformation. And the relevance of this particular podcast is that we have a federal agency that is attacking the whole infrastructure of vaccines. And so individuals who don't use trusted messengers of physicians and other healthcare providers get their information from social media and from other disenfranchised individuals, and they spread malcontent with regard to the trust that they should have with the vaccines. And so in the Black community and in the Brown community, it's very important for us to be outspoken, for us to create avenues for sharing relevant and truthful information about vaccines. A lot of people's beliefs that don't come from those positions of mis and disinformation, it's hearsay within their community. And so where there is, this is what grandma said about flu vaccine, so I'm not getting it, gets passed down through generations. And so it's a process of us in the practice setting and in the community to re-educate them to break those cycles of misinformation.
And one thing that I like to do is to make my family a little more aware, because in our, in this era, oftentimes the diseases that they're getting vaccinated against, we've never seen, many people have never seen anyone with those particular illnesses. And I know, I'll often let them know that before vaccines, from the information I found, before the 1900s, before vaccines were, spread throughout the world, that about 1 out of every 2 children, so like every, half the children before the age of 5, they died, oftentimes, most commonly, of some type of infectious disease. So we went from about 500 out of 1,000 children dying in the, before the 1900s, to the last statistics I saw was about 37 out of 1,000 children dying. And that was in 1993 when I saw those numbers. And so for me, in my practice, parents can come if parents do not want their children to get vaccinated, then they're not actually allowed to be part of my practice, because I make them understand that if I have a child who comes who is 12 months old and they're not old enough to, or I'll say 9 months old, not old enough able to get the MMR or chickenpox vaccine, then and their child who is old enough, so past that age, is able to get the vaccine, but they get those illnesses, they could pass them to one of my children who wasn't old enough and has a immature immunity, and therefore that child could get the infection and, suffer, much worse consequences. And so for me, again, if they don't want to be vaccinated at all, then they won't be able to stay in my practice. And most times parents will understand that and understand how it's important, not only for their child, but for the community, that everyone become vaccinated.
So I love what both of you just said. So Dr. Price, you talked a little bit about families and trusted voices in physicians. And what I love about this is both you and Dr. Petty, you live in the areas that you also serve. So that increases the trust with your patients, with the families who you are around. You have data, as you all have just shared with us. There's lots of information around what you're sharing. And Dr. Petty, I'll go to one item that you just mentioned about there was a period of time when when everyone wasn't vaccinated. And I'll say this, when I was born, I grew up with an aunt who had polio. And many people will say, well, I didn't know anyone who had polio. I knew someone and lived with someone who had polio, and she walked with a crutch.
Yeah.
Yes, her whole life. So yeah, just interesting.
Let me mention too that my uncle, so I share that story oftentimes. My uncle had polio as a child, and he was paralyzed on the left side of his body his entire life. So, those types of things are things that people don't see now. So then they think, oh, what am I getting vaccinated against? But
right.
Yeah.
So those are important stories and storytelling is another thing I think about, is that we share these stories. Oftentimes people don't want to share their family history or background or experiences, but physicians like you all do share those personal stories and share information as needed to help make your patients feel more comfortable. So again, those trusted voices are so powerful in our community. I'll go back to one other point, Dr. Price, you mentioned about misinformation and a lot of things going around now. So it does cause us to ask questions and wonder if we're doing the right thing. Something that I've been hearing about lately is that individuals aren't able to get vaccinated.
Mhm.
Can you tell us if we are able to get vaccinated, if they're community friendly? Is insurance covering vaccines? What are we hearing about those types of things?
Right. Well, the reality is that we've moved very effectively with this public health strategy, and since the early 60s, really into certainly the Affordable Care Act period, we've had vaccines for children who are in underserved communities or who are in states where there is a Medicaid managed care program for children. And so Vaccine for Children's Program, or VFC, provides free vaccines for all of those children. And so in those states, like Georgia being one of those states, there is no reason for a family to feel that they're not able to get their children vaccinated because of the cost of those particular vaccines. And indeed, in the individuals who are not eligible for the VFC program, there are sliding scales for the vaccines in some of our federally qualified health centers, where for a nominal cost, they can receive the vaccine. And lastly, in all of the health departments, anyone, whether they have insurance or not, can receive the childhood vaccines free of charge.
Excellent. Thank you for that. Now, are there still school requirements for vaccines here in Georgia?
In Georgia, there is, but as you know, there is a landswell movement to eliminate that requirement. And the importance of that is that the process, some of which Dr. Petty alluded to, the process of deciding what vaccines are important for children to get are based on the Centers for Disease Control, or CDC, making those recommendations. And then the ACIP, the American Committee on Immunization Practices, they, in a sense, ratify those decisions based on the science. And once that is done, all of the insurance plans, as well as Medicaid and Medicare, follow suit. And so if it's a mandate by those organizations, the states generally make that the mandate for school entry based on the vaccines that are recommended. Once you remove that state mandate, then you leave the onus of getting the vaccine to the parent. And if the parent, for whatever reason, decides that they don't want their children vaccinated, then they put those classrooms at risk, because as Dr. Petty described, you have those unvaccinated children attending school next to children who may be not fully immunized because of their immune system, not so much that they did not get the vaccine.
Right.
And they also put adults at risk who may have other immune disorders, treatment for cancers. And so those children who are unvaccinated carry the disease to those parents, who then take that disease to their own households. So the public health strategy of vaccines is not only to protect the children, but it's to protect the immediate family and to protect the community. And so that's all an important public health strategy to develop that herd immunity, as we call it, where we have enough individuals who are vaccinated to not allow the bacteria or organism or virus to penetrate and cause disease in the community.
And I want to say too that for me, it's also important, as Dr. Price was mentioning, that once the CDC and the American Academy of Pediatrics makes those recommendations for vaccines, that is what the school systems use, the insurances use, and if the vaccines are not recommended or mandatory, then insurances also can then say, okay, well, we don't have to necessarily pay for this. That then again puts our families and our children at risk, because if families have to pay for those vaccines themselves because their insurance isn't covering it, of course they're not going to be as likely to be able to provide those or agree to get those vaccines for their children.
So that sounds a little tricky when you mention that piece. For me as a parent, it makes me feel a little concerned. So what kinds of things should I as a parent advocate for, or what can I do in my space if I was told a vaccine wouldn't be covered? How could I advocate for myself or talk to someone about ensuring that vaccines are covered?
Yeah, I mean, talking with your health provider, also talking with the medical board in your particular community. Your elected officials are always a resource because they're going to be up to date with the practices in that particular community. But as I mentioned, there's always a health department in your community who will have the most up-to-date information and the availability of the vaccines at low or no cost. Some of these vaccines cost $300 and $400 per shot. So this can be an exorbitant cost. There are about 25 to 33 individual vaccines that children get between birth and 16 years of age. And so you can imagine that this can cost tens of thousands of dollars if it was an out-of-pocket cost. But there is no need for any family to incur those costs within the structure that we have here in Georgia.
We just need to maintain our structure.
Yes.
Yes, that is important. And so you mentioned from birth to age 16. Are there specific vaccines that teenagers need to get?
Absolutely, absolutely,
Okay.
and I guess the the real life stories is that the vaccines for meningitis, where there are 2 vaccines that are required. You can have a child, as I had in one of my patients, who's a very avid sports individual. And one of them was involved in the wrestling team, but decided not to get the vaccine. And from the day that they started on the team to a week later, they had a lower leg amputation because they developed a meningitis infection. And so, a parent can bring their child up through all of the trials and tribulations of childhood and teenage years, and then have a child have a devastating illness only because they felt a teenage vaccine was not as important. So we certainly encourage parents to continue all of the vaccines that are recommended by the Advisory Committee on Immunization Practices.
And thankfully, those meningitis vaccines are the required ones for our high school students.
Mm-hmm.
Excellent. Okay. Thank you for that. So in this discussion today, you all have shared a lot of information with us. I think as a parent, I feel more comfortable and confident in what I've heard tonight. Is there anything in particular you want to share with our listening audience, our community, our church members, our fraternity brothers and our sorority sisters, or just anyone that needs this information, some last or key points?
Well, one key point I want to make is you frequently hear reference to the establishment, if you will, that is trying to take us backwards, that we need to do more studies. All of the vaccines go through a very rigorous trial and investigation to make sure that they meet all of the standards in terms of safety, in terms of effectiveness, and in terms of minimizing the side effects that can occur with any medication. And with that, there are studies that are done to refute all of the misinformation and disinformation that is even coming out from our Department of Health and Human Services as we speak. And so I think it's important for parents and communities to understand that they simply need to go to a trusted resource to find out whether, and they can ask those questions both to the health provider, but they can ask it to the medical society, whether the studies have been done. And case in point, one combination vaccine, the MMR combined with the varicella, combined for chickenpox, measles, mumps, and rubella vaccine. You heard the latest recommendation come out from our government saying they want to split those vaccines so that the child will get an MMR from the varicella vaccine. Well, all of the studies to make sure that the combination vaccine was just as effective and didn't have any increase in side effects or increase in the risk of autism have been done. And so there's no basis for them to decide to split that vaccine. And what parents have to understand is when you split that, that means the child has to have 2 injections instead of 1. And whenever you have 2 vaccines that have to be given, the risk of the child missing one of the vaccines increases. And as we mentioned, the immunization rate in our Black and Brown community is not as good as we would like it to be. And so you want to make sure you don't have those missed opportunities with effective vaccines. And there's no thimerosal or mercury in the vaccines that we give children. This is another misinformation that is thrown out by individuals who are counter to vaccines to try to get parents afraid to get their children vaccinated. We don't have mercury in the vaccines that we give children today.
And I wanted to say equally, just as Dr. Price was mentioning that parents could, get the information about the all of the studies that are done. One of the things that I always tell parents or encourage everyone in our community is to make sure you get with a physician whom you can trust. And one of the things that I do with my parents, whenever they're having questions, I also make them understand that everything that I'm wanting to do for their child, these are the same vaccines that I've given my own children and now my grandchildren. And so that they can, and I also make them understand that I'm never going to do anything to hurt their family, just as I would not want to do anything to hurt my family. And so I would want, all of our, everyone in our community to go get with a physician that you can trust, and you can trust the information that is coming out, because what happens is with this current administration, and I think that it will continue to happen going forward, is we get all of this misinformation about vaccines and our healthcare in general. And the only way to get the actual information and know that you can trust and you can believe and you can move forward with your own healthcare and that of your children is to get with physicians that you can trust.
Excellent. And both of you have given us really solid information. You have great stories and experiences. And I have one question that just popped up from one of our audience members. Wanted to ask about the HPV vaccine. Can you share information about that specific vaccine?
So HPV is the human papilloma vaccine. It's for human papillomavirus. And it's one that a lot of parents have seen the commercials and said, oh, if I had known. And so I'll reference the commercials sometimes to parents. But for me, having been in practice now for a little over a couple decades, I think what I wound up doing with a lot of my parents, because they associated, human papillomavirus is a sexually transmitted disease, causes genital warts. And so sometimes we'll have parents who are hesitant about giving that vaccine to their children. But, I let parents know that I understand, but in this day and age, we want to protect our children as much as possible, because a lot of times we're not with them. They're in school, they're other places. We don't know everything that they're doing, and we don't want them to wind up getting a disease that possibly could have been prevented before they became sexually active. And so that's, for me, when I'm talking to parents, that's usually the information that I give that usually helps them to look at it from a little bit different perspective of being able to protect their children from, the possible consequences of HPV, which can cause prostate cancer in men and boys, and can cause cervical cancer in girls.
Yeah, so on the HPV, that kind of emphasizes the CDC's recommendations for following the immunization schedule. Vaccinating children on time protects them and everyone around them who might have a weakened immune system, as we mentioned. But it's the ideal timing based on the research to make sure that we get the most effective result out of the vaccines. And this timing comes from hundreds of thousands of country doctors, public health professionals, and scientists doing the research over and over again to make sure we can be effective in protecting children. And as far as delaying disease and preventing complications, given the vaccine before individuals are exposed to the disease increases the likelihood that they will have protection. 50% of the sexual encounters by teenagers are not planned. And so how can parents say, my child is not sexually active, so I'll wait till they're sexually active to give them the HPV vaccine? you and even the child doesn't know when that event is going to occur. And so giving the HPV vaccine, which is recommended anytime after the age of 9, but mostly given at 11, allows that child to develop the protection to protect them against those diseases. But also the HPV vaccine has eliminated millions of cases of cervical cancer because it is associated with that HPV virus. And then lastly, making sure that parents understand that even though they may say, I'm breastfeeding and so I don't need to vaccinate, the antibodies, the protection from breastfeeding is not as long lasting as the protection that occurs as a result of getting vaccinated. So that's why we're fairly strong about not only protecting that individual child, but again, protecting the family and the community. And a lot of individuals who have gone through this pandemic have immune deficiencies that are part of the long COVID. And so those individuals are at risk for some of these diseases that we've pretty much eliminated in the post-vaccine era. But those adults are at risk for developing things like shingles and getting pneumococcal disease again and RSV. And so it's important that we vaccinate as many children as we can. The World Health Organization guidelines is to be 90% or higher in all our communities. And we are desperately, for some vaccines, barely getting above 65% protection. And that's unacceptable in our developed country.
Wow, that's again, it just speaks volumes about how important this is. Vaccines save lives. I have one final question, which is, I believe it's in line with vaccines. Do you all have any feelings about flu shots? It's fall, we're transitioning into another season, the time will be changing soon, and we hear things about flu shots. What are your recommendations there?
So for me, I like doing the flu mist vaccine with my children. So you can get that starting at age 2. They're under 2, then we do the flu shot starting at 6 months. I definitely recommend that vaccine. I have patients all the time who will say, oh, well, not patients, usually the parents. Well, I know such and such, or when I got the flu vaccine, I got the flu. And so I will oftentimes have to tell them, with the flu shot, you cannot get the flu. You can get some type of symptoms, but it's not the actual flu, because the flu shot is not a live virus. And so I explained that to them. The flu mist is a live attenuated virus, but with those, I'll tell them sometimes you may get a little, sniff, little congestion or so for a day or two. But the reason that flu mist vaccine, the reason that I like it is because it lasts for at least a year to protect from the flu. And for, most people don't realize that when they get the flu shot, definitely I would want you to get that if you can't get the flu mist, but the flu shot will last for about 4 or 5 months. So it'll take us through most of the season. But if I can get that flu mist in, as soon as I get those vaccines in, I start doing them, because I know that's going to take my children through the entire flu season. So the other thing that I tell parents all the time is that I've never had anyone who has died from the flu shot or the flu mist, but people die every year. 50 to 80,000 children die every year from the flu. So they're much more at risk for something bad happening if they don't get the vaccine.
Yeah, the flu shot is important. I've gotten mine already for this year. I think the number of myths about the flu vaccine, some of which Dr. Petty alluded to, relate to hearsay within families and misinformation, disinformation. And the point with the flu vaccine is how smart that particular virus is. And so every year, scientists have to, early before the flu season, decide what the change in the flu virus is going to be, and to begin making that vaccine in late spring so that it's available for the season. And unfortunately, this very smart virus doesn't always have a vaccine that is 100% effective. And so it takes 2 weeks to get protection from the flu vaccine. And so an individual who gets the vaccine one day and then gets the flu next week equates that flu to being from the vaccine, when all it means is they didn't get full protection as yet, or that the vaccine was not 100% effective. And so they get a milder case of the flu, even though they got the vaccine. But the more people that get the vaccine, the less likely the flu virus is going to ravage the community. You know, last year and the year before, we had schools closing because half of the class and the teacher had the flu. We can prevent that by vaccinating individuals against the flu. And all of the myths about I have an egg allergy and I can't get the flu vaccine, that's no longer a contraindication. Number two, we have a flu vaccine that is not made from any egg products, and so they simply need to plan ahead to get the one of egg. And then, as Dr. Petty mentioned, the one that's going to last the longest and give a higher level of protection through the season is the flu mist. They've even made it easier for individuals because this year you can self-administer your flu vaccine and go to the pharmacy and pick it up. So those kids who have white coat syndrome, doesn't want to go to the doctor's office, can have that parent go to the pharmacy, get the flu mist, and administer it to their child at home in the comfort of their bedroom.
Wow, that is new information. I'm going to have to run down to my pharmacy and get the flu mist. How exciting. Well, this is excellent information. Thank you so much for helping us out, walking us through. Dr. Petty, Dr. Price, we appreciate you joining us today. Your expertise, your experience, your wisdom, your stories. This conversation has been amazing. And again, we appreciate you taking care of our children, taking care of our health. And for all of our listeners, please remember that vaccines save lives. They help protect us, our families, our neighbors, our communities. So do it for yourself, for your neighbors, your friends, and your family. And thank you so much for joining us. Until next time.
I will just say one thing: vaccines alone don't save lives. Vaccines in the arm save lives.
Okay, in the arms, in the arms.
Yes, and I will provide some resources or websites that you can use for your listeners to get additional information.
Thank you. So we'll look for those resources. They will be here available to you. Thank you again for joining us. And until next time.
Thank you.
The content shared on this podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by our guest and host are their own and do not necessarily reflect the official positions of GSMA. At GSMA, we stand on over 130 years of medical excellence and advocacy, but we encourage you to always consult your physician or qualified health provider with any questions you may have regarding a medical condition. If you think you may have a medical emergency, call your doctor or 911 immediately. Until next time, stay informed, stay empowered, and stay well.